Thank you for joining us. You are a part of a powerful group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For almost 40 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Good evening. Thank you so much for joining us. We're so excited to have you and celebrate Black Maternal Health Week with you this year with the theme around reclaiming joy and autonomy. The Black Women's Health Imperative tonight aims to engage and include Black men in a discussion on the critical issue of Black maternal health in the United States. The purpose of this panel tonight is to really explore the role of Black men can play in addressing the crisis. While maternal health outcomes for Black women and birthing people in the United States are among the worst in the developed world, Black men have not had the privilege to enter into a safe space where they can be vulnerable about their voices and also be heard. So we want to make sure that we're also engaging men in this conversation. As a community, we need to come together and center solutions around all of us. Our panel aims to explore the ways in which men can contribute in the fight for maternal justice and birth equity. We also want to uplift and highlight our sponsor for tonight, Quilted Health. Quilted Health is a midwifery-led practice of certified nurse midwives, nurse practitioners, and social workers that work together to offer antepartum, intrapartum, postpartum, gynecological, contraceptive, and behavioral health services. Quilted Health's overarching mission is to build and champion a model for equitable access and compassionate, evidence-based whole person care. So we're really happy to have them partner with us on this event tonight. Our panelists tonight that I will introduce consist of experts from various backgrounds. They are also fathers, uncles, brothers. That includes healthcare leadership, public health, midwifery, tech, innovation, and education. All of that consists on the panel tonight. Each panelist will bring their unique perspective and expertise to the discussion, and together they will examine the impact of systematic racism, socioeconomic status, and cultural norms on maternal health outcomes for Black women. The panelists will also explore the barriers that prevent men from being active participants in the birthing space and will offer practical solutions based on their experiences. So bringing together all these different fields, we will foster an intersectional and collaborative approach to addressing the Black maternal health crisis. So I'm going to start with introducing our panelists. So first, I'm going to start with our moderator, Jonathan Webb. Jonathan Webb is the Chief Executive Officer of Association of Women's Health, Obstetric, and Neonatal Nurses, AWHONN. Jonathan has spent more than 15 years in the public health space, promoting community health outcomes, addressing the social determinants of health, and tackling a number of epidemiological, epidemics, including childhood obesity, diabetes, and CVD. Jonathan's professional experience also includes working with local departments, including the Office of Epidemiology in the city of Chicago, leading community health divisions, and also in the city of Evanston. And he spends most of his career over his time leading in nonprofit spaces, building meaningful partnerships, fundraising, and all the good things. So we welcome Jonathan to our panel. We also have with us William Moore. William Moore is a graduate of Concordia University, St. Paul. He's a De Beaumont Foundation 40 Under 40 Public Health honoree. He is a race and health equity administrator for the large service team of the Ramsey County local government. William also works in child and maternal health as a doula and lactation educator who addresses disparities in maternal death rate and disparities in infant mortality rate. William was profiled in 101 Careers in Public Health and is the first male doula in the history of the state of Minnesota. He has a consulting firm focusing on showing direct services providers how to include more men in the birth process, to aid in the decline of the aforementioned disparities, as well as helping families successfully co-parent to ensure their children hit all their early childhood milestones. Next, we have Mohamed Kamara. Mohamed Kamara is the founder and CEO of InovCares, Connected Comprehensive Healthcare LLC. He was inspired to develop InovCares following the tragic loss of both his sister and his aunt to pregnancy, hemorrhage, and preeclampsia. Previously, Mohamed was the director of operations for the Russell Innovation Center for Entrepreneurs. During his time at the center, he supported 150 minority-led businesses from idea to growth stage and headed the center's nonprofit financial operation affairs. Mohamed is also the host and producer of the Empowered Patient podcast, sponsored by InovCares, where he connects with healthcare providers, payer executives, and other healthcare leaders. Mohamed holds an MBA in finances from Mount Vernon Nazarene University, I hope I said that right, Mohamed, and a BSBA in economics and accounting with a minor in political science. Wow. And then we have William Rowe, who is also representing Black Women's Health Imperative tonight. He is a senior program manager of the men's room with the Black Women's Health Imperative. In this role, William supports organizational initiatives related to diabetes prevention, management, and Black men's wellness through the framework of the National Diabetes Prevention Program. Prior to joining the Black Women's Health Imperative, William supported the Maternal and Child and Adolescent Health MCAH portfolio at the National Association of the County and City Health Officials, NACHO, where he also led 2 CDC-funded initiatives. William has over 7 years of experience in maternal and child health, which includes his work as a lactation educator. William received his Bachelor's of Science in Food and Nutritional Science from North Carolina A&T University and earned his Master's of Science in Nutritional Biochemistry from NC State University. William is currently pursuing his doctoral degree in experimental nutrition at Howard University, HU. So thank you to our panelists for joining us. And looks like I will be kicking us off. So our first question here, I will start. What motivated you to work in the maternal health space? And what was the defining moment for you to make this a part of your life's work? And I would love to start with William Moore.
Yeah, so much like a lot of things in my life or career, like it's one of those things where I kind of fell into it by accident. And once I got into it, I realized like how passionate I was about it. So I was working in, Ramsey County Public Health and chronic disease prevention, but also helping co-facilitate some monthly men's groups. As I was helping to co-facilitate some monthly men's groups, one of the public health nurses asked that I start joining the Birth Equity Community Council, and so that they could have some a male presence and a part of the group. As the Birth Equity Community Council is a collection of public health professionals, healthcare professionals, and community members who meet together every other month to try to essentially solve the county's and the nation's maternal death disparity, the disparity rate within the maternal death rate, and then also the infant mortality rate. And then, as time went on, like one of the main ideas of it is to come up with creative ways to address these issues. Well, there's a public health nurse there by the name of Ms. Tamiko Ralston, who came up with the idea of training men to become doulas and lactation educators. And she came up with this idea because she kept hearing from a lot of the community members how there really aren't enough parenting resources or birthing resources out there at all, focused or geared toward men or bringing men into the space. So her idea was, if we could train men to become doulas and lactation educators, not only would they become more knowledgeable about the birth process, gain more confidence, but also be able to be there and support their partners when engaging with direct care service providers. Because as we know, our disparities are so high because a lot of our doctors and nurses aren't listening to our women when they're talking about the issues that they're experiencing during the birth process, both pre and postpartum, which is leading to their death. And so while we were sitting there, she came up with this idea. The next question was, everybody was asking, well, where are we going to find a man who's willing to do this and engage in this process? And so, I just raised my hand and volunteered. So really, it started off as me really trying to be a part of another creative way to give back to my community and to help address some disparities in my community. However, during the midst of my training to become a doula and lactation educator, when I started learning about birth work in general and how it wasn't this, as it's packaged now, this field of work or space that middle to upper class white women use or engage in or had access to bring their babies in the world. And I learned that it was something that we have been doing since we came from the continent, right? And knowing like that lineage that we that's been passed down, from birth worker to birth worker, it started to feel like essentially, to me, it started to feel like a historic, a cultural responsibility. And so whereas it started of like falling into it by accident, started learning the history of it as many of us do, and it starts to become a sense of pride about it. And that's kind of how I got into the work and began championing it.
Thank you. And thank you for that historical perspective. William Rowe, I will let you jump in about, how you entered this space.
To this space specifically in a course from my undergraduate studies at North Carolina A&T. I will never forget, I took a course called Maternal and Infant Nutrition, or Nutrition Through the Life Cycle as well. And so in that course, we had to complete a capstone paper. Our professor had given us a number of topics. Nothing interested me. And so I simply just said, you know what, I see one thing here and it's on breastfeeding, right? And so engage in my studies. And as I'm looking for my research articles and just working on this paper, that's when I realized, wait, there's a disparity. There's something missing. I only saw that there was, even in the imagery, in the context, in the studies, everything was around white women. The little information, the little knowledge that was available on Black birthing women and birthing people, it was all around how they are missing the mark. And then I looked at the CDC's breastfeeding report card at that time. This was in 2012, 2013. I looked at the CDC breastfeeding report card, and in the southern states at that time, the CDC used on the map, the color was red, like different shades of red. And the southern states had the darkest colors, which meant that breastfeeding rates were the lowest there. And when I broke that data down to look at African Americans specifically and Black women, Black and brown communities, our numbers were sparse. We're looking at numbers from 57% to the high end of 70%, 71%. And so at that moment, I said, I have to do something about this. And I began to engage in the conversations just with friends and family. And I've even had friends and family, when I say breastfeeding, chest breastfeeding, they kind of look at me weird. And so it was in that moment where I said, you know what, I got to do something about this. I want to be that change agent. I've always been that type of person. I'm a little just, almost aggressive when it comes to creating change within a community and within certain spaces. And so because of that, that's what made me say, you know what, I got to commit myself to this. I wanted to always work in public health. I always wanted to make sure that I'm doing something that's going to support my communities and uplift women, especially. And so that's where I'm at now.
I am muted, sorry. Thank you so much. And thank you for pointing out that you saw this lack, in the community and textbooks and information. I think one of the ways racism works is that we think that seeing that, we start to normalize it and think that seeing things like that are normal. So really appreciate you for recognizing that and calling that out. And then also saying, even though because I'm a man doesn't mean that I can't shift and change the narrative around breastfeeding and making sure Black women are included and see themselves. So thank you so much. Switching over to Mohamed. Mohamed, would love to hear your journey and story to this work.
Sure. Hey, Kanika, thank you so much for inviting us to this space. And for me, I'm coming into this space more of from an advocate point of view. It was my sister and my aunt that led me into this space. My sister was delivering her fourth child in Sierra Leone when she suddenly passed off pregnancy hemorrhage, rushed to the hospital, bleeding profusely. They couldn't stop the bleeding. That led to her death. And then I became caregiver for her, my sister's kids. She had left 3 kids behind, so I support them financially. My mom oversees them. Start asking the question, why is this continuing? Strike 2 happening in my life in Columbus, Ohio, where my aunt died of preeclampsia. And it was her second delivery. The first one, she had twins, so she has 2 beautiful baby girls. And then the second one, she had passed of preeclampsia. The son survived, and then my dad and my stepmother became caregivers for those kids. So that led to the forming of the company, InovCares, to really, how do we connect women of color as they go through their birthing journey from preconception to postpartum, and ensuring that the right clinicians are touching them. So keeping those clinicians honest, whether that is ensuring that they go through a culturally competent training in order to use the platform. So I just use my tech skills and created 2 mobile apps that are on iOS and Android to be able to connect women searching for providers that are culturally competent via video, message, and as well as in person. So this is what led me to this place, mostly from an advocate point of view, and how do we ensure that we access care and the right clinicians are touching those patients.
Thank you. And I find your story so moving because you've experienced, this situation on the continent, probably considered quote unquote an undeveloped nation, and then the same thing happened to your aunt in the U.S. And just seeing both of those scenarios, and that we talk about how our numbers mirror that of less resource nations, and you experience that firsthand. And, we all feel you. And again, I'm sorry for your loss. And thank you so much for stepping in this way, not only to care for your nieces and nephews and your siblings, but then also to take action and provide us with the resources that we need based on your expertise. So now I'm going to invite Jonathan in the space. It's Black Maternal Health Week, so everyone's busy trying to do double duty, but Jonathan is here with us now, and we're happy to have him. Hey, Jonathan, how you doing?
Hey, Kanika, how are you?
Good. Great to see you. Thank you for joining us. And I will ask you the same question. What brought you into this space? And Jonathan will also take over as the moderator for this panel. We really wanted to make the focus on men and have them have a conversation with each other. So Jonathan, I will let you take it away. Thanks so much for being here.
Well, Kanika, first I'd like to thank you and the Black Women's Health Imperative and our friends at Quilted Health for highlighting this conversation. I think it really is important for us to have this dialogue and be able to have this dialogue so that we can support our partners, our family members. I think we all are connected in this fight, in this struggle. So I really want to thank you for bringing us all together and allowing this conversation to take place. What brings me to this space, there's a professional and a personal connection. So I've been in the public health space for almost 20 years, focusing on how to bring about equitable outcomes. And those equitable health outcomes, in my mind, start with our communities, our families, our moms, babies, and seeing how there has been a stark inequity in that really motivated me to try to figure out ways to empower and uplift the voices of those around me, when I've been put in places or been blessed to be in places to make a difference. So professionally, it's something that I've focused most of my career on, trying to bring about equitable outcomes and support our most prized assets, our most prized treasures, our families, our moms, our babies, our communities. And then personally, I've shared in different settings that my wife and I have been have experienced some of the systemic racism and challenges that exist in the healthcare system. And I have, through conversations with other friends and family members, what we came to believe or thought of initially as a unique experience of not being heard, of not being valued, of feeling as though there was some deficiency that we were presenting with, and not feeling like we were being seen. We came to realize after conversations with other family members and friends that this was not an anomaly. And it was interesting because as a public health professional, I kind of knew some of the data, but it's different when you're actually experiencing it firsthand. For me, this has been an opportunity for me to try to bring some of my lived experience into this space as a personal passion of mine. I think I share with some folks that I consider it a privilege to have this work line up for me along 3 Ps: position, passion, and purpose. And having those 3 align really fuels me to be an advocate and be supportive in this space. So thank you for the opportunity to have this dialogue with other men who share that passion and purpose. I did want to take the opportunity. Thank you all for sharing your stories and what brings you into this space. I wanted to get a little bit, dig a little bit deeper into your work and just talk a little bit about some of the wins that you've had in this space. Oftentimes, we obviously look at some of these challenges from the glass half empty standpoint, and it's a really significant challenge that we're dealing with. But are there wins that you've had that we can highlight as we look to provide insights and recommendations for others who are looking to be champions and advocates, other Black men who are looking to be champions and advocates in this maternal health crisis? So I'll start with maybe you, William Moore. Are there any wins that you can talk about that you've had that you'd like to share?
Yeah, I think for me, the more prominent wins have been the acceptance of men being in the space. Because of the different stereotypical like gender norms that we have, like here in America, like in a lot of ways, men are rendered like nearly invisible in the birthing space, either by our healthcare providers or professionals. And sometimes it's not just them. Sometimes it's our friends and family members, right? I can't tell you how many times I've seen, a soon-to-be new father, excited talking about like, hey, you know what I'm saying? Like, we're having a baby, we're this, we're that, and people cutting them off right there, like cutting them off at the knees. Like, you aren't doing anything. You're not going through the labor. You're not going through the hormonal shifts. Your back's not hurting. You're not gaining weight. Your feet aren't swelling. And it's like really isolating and dismissive of a male's presence in a space. And it's also wrong because science does show that a lot of times men go through these hormonal changes as well, while their partners are in the midst of the birth process, and they also experience postpartum depression as well. And so it's really making sure that men are recognized in the space, and then making other brothers feel comfortable expressing their interest in the space. And what I mean by that is, you got a lot of brothers who want to be more involved. And want to be more involved in a birthing space, both in the medical sense, but then also for their partner. But because of this messaging that they're constantly receiving from different spaces, we condition a lot of brothers to feel like, well, the only responsibility I have towards my babies is to make sure that they are disciplined, financially cared for, and I'm sheltered, and I'm feeding them once they're born. We dismiss everything else, even though scientifically and logically we know that it takes more than those things just to be a father, right? And so really it's been a huge success opening the conversation, starting the conversations, and for healthcare providers and families in general, family units in general, saying like, you know what, yeah, they can be involved more than this. They should be able to be in these prenatal visits, asking questions, getting answers, being a part of birth plans, deciding what happens, having conversations, co-parenting conversations about, what role is each parent going to play after the baby's born. Because in a lot of times after the baby's born, it's too late to be talking about those things, right? It's game time now. People are stressed out, aren't getting enough sleep, and they're just trying to make it, just trying to, especially if it's their first child. So I will say right off the bat, before I cede the floor to my colleagues here on the camera, those have been some of the biggest successes that I could express today.
I appreciate that. I do want to take a moment to remind our virtual audience that there will be time for question and answers at the end. But if at any point in this discussion you want to put a question into the chat or comment to the chat, please feel free to do that, and we'll circle back to that a little bit later in our discussion this evening. I want to open the floor up to William, Rowe, or Mohamed to jump in on the wins. I do want to put a pin in something that you mentioned, William, more though, and we'll circle back to it. But this notion, that obviously we're not experiencing some of the physical and the hormonal changes in the same way that our partners might be. But how do we show humility and not be arrogant in our ways to demonstrate and say that we want to be supportive and want to be engaged without diminishing some of the challenges that our partners are experiencing. So I'll come back to that question. So I'll give you a chance to kind of ruminate on it, but I'll open it up to Mo and William to weigh in on some of the wins they've heard of or had in the maternal space.
Yeah, thank you so much for that question, and William, really to even share some of your opinion here. Looking forward to diving into the follow-up that Jonathan just asked. For me, once that lived experience of what happened to myself, to my sister and my aunt, something that's much more noticeable was after creating InovCares, there was a particular patient who walked into our door because she was experiencing issue getting pregnant, and that difficulty of experiencing that pregnancy issue getting pregnant, it led her to our door. She had an OB/GYN physician that was being highly dismissive of her need, and the OB/GYN physician, she wanted a second opinion, and thankfully we were the second opinion that she found us online. We connected her to a culturally competent OB/GYN physician, Dr. AWHONN, and that physician himself, he's a male, but he's been in this place for about 30 or 40 years now as a OB/GYN physician, practicing out of Waldorf, Maryland. The two of them connected, and he told her a treatment plan for her infertility. He also then prescribed prenatal vitamins, which we sent to Matthew's home directly. Fast forward 2 months after she texted the physician that she's pregnant, then 9 months after her son, John, was born alive and well. So there in itself, you notice the power of what technology can do to connect two people that are in two separate states, to connect because that person was intentional of finding a clinician that will listen deeply to their needs. And thankfully, a clinician, like, he's a male, but he took the time to listen intently to the patient's needs, and then also then understanding their socioeconomic background. So that patients, their tropical background, tropical diseases, right, that they sometimes will experience, and being able to then prescribe the right treatment plan for that particular patient. So not just an overarching treatment plan, but one that's customizable to her needs, led to now having a child that is 3 years old running around, a boy. And that's the power that technology can actually play in this space, to ensure that there's safe environment and a safe community for moms to engage, find the right clinicians, and also just engage as well in terms of sharing materials, education. So that goes, for me, that's the level of impact I want to continue to make in this space, to ensure that moms of color have a safe community where they can be vulnerable, right, ask the right questions, and connect to the right resources and clinicians to support them. And then personally, I remember more vividly here my sister, when this is my second older sister, not the one that passed, Emma. She was delivering her second child, and I had her. I had my nephew, the oldest, with me, and I was taking care of her while she was in the hospital. I was taking care of him while she was in the hospital. I will take him to daycare, bring him home, change his diaper, feed him, take him to his mom, while the mom was in the hospital, bring him back, and then the bedtime story, and then repeat the same process. It was like 2:00. I would leave work to ensure that he's taken care of. Thinking through that, that's technically a little bit of the role of a doula I was playing. I didn't realize that was the technical word for it, but I guess that is a thing as well, that ensure that mom can focus on delivering and she's less stressed, so playing that emotional support role, which is one of the more important and crucial role that a doula plays as well.
Well, thank you, Mo, for that. Thank you, Juan, for describing that support, because I think in many ways there are men and there are folks who are playing those roles and may not understand what the technical term for it is, but thankful for people like you and other men who are playing those supportive roles, and then for your health, your technology solution that's able to provide some much needed information and access across geographical lines as well, to get the care that is so sorely needed. So thank you for that. William Rowe.
I just heard that I want to amplify. It's the common theme, and it's this right here, which is simply community. I think that's one of the biggest wins as well, is that there's a sense of community that's being built amongst Black men. Because number one, when we're talking about the birthing process, there's other men going through these same feelings. There's other men trying to figure out, how can I better support my partner, my spouse, right? And so we're building community right there. We're having them have dialogue together. And then things like this, having conversations now. I definitely believe that we're in this time frame of where I'm a millennial, I'm a younger millennial, and I think millennials are now having those tough conversations. So I think that the biggest wins now are just simply conversations are taking place, and then we're building community. And then that's elevating all of the common themes that we're going to continue to hear throughout this panel and discussion tonight.
Yeah, I appreciate that. So the sort of normalizing of these type of conversations, and the vulnerability that we as men should embrace. That there's certain spaces that we're in, or certain issues that we're dealing with that historically we've had to feel like, to your point, William Moore, that we either didn't belong or didn't have a voice, or if there was any sort of question or concern. I know as a new father for myself, not having information readily available and trying to seek it out, not necessarily knowing where to go to, but being able to be in spaces that we're creating now where we can start to have these conversations, that my experience is not that different than Mohamed's and not that different from maybe William Moore's and William Rowe. And we can start to lean on each other as we're providing support to our partners, and express that vulnerability, but also get some strength in knowing that we're all dealing with very similar, potentially, aspects of this maternal health journey, and how we can support our families in the appropriate ways. So we're not having to deal with this alone, or having our partners feel like they're dealing with it alone because we don't have the resources to support them. So I appreciate that, the normalization of these type of conversations. I did want to come back to and expanding on one of the comments you made, William Moore, around some of what I would describe as the barriers that men experience as we're trying to be supportive. And obviously, as I was mentioning earlier, there's some things biologically that we will just never know what it's like to experience. Coming into this space, personally speaking, I've been appreciative of the invitation and the acceptance of being seen as an advocate. I've been thankful for that. I've been hopefully respectful for those individuals, those women birthing and pregnant people I've had a chance to engage with, I've hopefully been respectful of that invitation. But it can at some points in time be considered a barrier. Why are you in this space? You articulated how there's this perception that because you're not experiencing these things biologically in the way that we think about them traditionally, that you don't really have a say or a voice, or why would you want to come into this space in this way? So I just want to sort of open the floor up to anyone who would like to talk a little bit about the barrier of stepping into this space, and the barriers that exist in terms of stepping into this space and being seen as a champion and advocate, and how you've navigated some of those challenges. I'll toss out to whoever wants to jump in.
I could start if you'd like, and then I'll toss it over to William more here. I think when you're asked this question, and I get this question all the time, for all of us here, we're coming in from the lens of advocacy, and understanding that it takes a family unit and it takes a village to actually achieve change. And part of that village, we're one of those villages, right? The men belong in that village as well. The aunties, the uncles belong in that village. And when I'm asked that question, particularly, I make an effort that the women on our team are the first to always speak, right? And I'll go last. Just because, one, it allows me to learn, and secondly, allows me to then appropriately provide comments based on my lived experience. It can be challenging when you ask that all the time. It does take the man and the woman, right, to create a baby. And when you're going through that birthing journey itself, during prenatal classes, to be a good husband or partner, you need to know exactly what are the challenges that mom is experiencing, and how you can be a better supportive partner. So prenatal classes is usually the introductory phase of, this is the things that you're going to expect during pregnancy. Your wife's body is going to change. And that change is that change is going to affect you, and it's going to also affect her, right? Because she's going to be looking to herself differently and questioning herself. Now, after the baby is here, there's also a thing that mom experienced, postpartum depression. Those are things that she's going to be experiencing. That, hey, am I good enough to be a mother? And those thoughts are thoughts that are dark. And she's gonna be vulnerable and share those thoughts with her partner, if that partner understands the issue that she's experiencing. And then him being able to say, here, I have a resource. There's a community of mom that has go through that experience that I can connect you to, or I can connect you to a psychologist, right? That can professionally help you as well, beyond just me providing that emotional support. So that's the lens in which I think we show up in this business as men, being supportive for our partners.
Thank you, Mo.
Yeah, I'll kind of jump in there. What Mohamed said a lot is really important. Said a lot is like, we are coming into this space like as advocates, but it's also our responsibility. And I don't want people to miss that point. It's our responsibility. Mohamed also said something well that I always quote anytime I do speaking engagements or I'm consulting people. Everybody, if I say it takes a village to do what, everybody knows how to finish that phrase off. Raise a child. But my question to that is, if we all know that it takes a village to raise a child, why are we constantly only equipping half the village to do so? Why are we constantly, like leaving our brothers out of part of this, or leaving our women out of some parts of it, just because we think certain responsibilities or certain things have to stick with like particular like gender norms, and it's not the case at all. Like, this is our responsibility. Now, the challenges I faced are different different based on who I'm dealing with. when I first started off in this work, the challenges I faced with healthcare professionals was just being taken seriously. What? You're a doula, but you're a man. Why are you, or hearing from people like doula, that's women's work, isn't it? No. Doula's work, a doula, birth work is family work. Making sure our women are safe, happy, and healthy, and our babies are coming into this world safe, happy, and healthy. That's everybody's responsibility. So I do family work. I don't do women's work. Is how I frame that. But when I was dealing with healthcare professionals, it was always, they might not. One thing they do understand, they understand data. And when you put the data out there to them about the disparities between and the maternal death rate between Black and white women, as it was, latest data showed us like Black women are 20 and 43% more likely to die of childbirth related causes than white women. When our their bodies are the same, that's a healthcare issue. And then a lot of people might say that's medical malpractice, right? When we look at the fact that, especially in my particular county, Black babies are twice as likely to die of white babies before the age of 1. We got to talk about structural institutional racism as a cause of that. So when I throw data out there, it's easy to address it with that. The least amount of pushback I had was dealing with mothers or women. They're just full of questions of being like, what type of services, what kind of help do they need? What type of things may they experience? What should they do? How to put together birth plans? And the challenges that I face from brothers is really about centered around their masculinity and their place in the space, right? Because again, when we talk about when a birth work being labeled or being in the birthing space being labeled feminine or whatever, and when you deal with the fact that in a lot of cases in America, there's a serious barrier for Black men when our masculinity is challenged. A lot of our brothers don't feel safe to be vulnerable, and to put yourself in the birthing space means that you have to be vulnerable, right? A lot of our brothers don't feel safe enough to be vulnerable, with not only do we have to worry about coming back home safely, but dealing with law enforcement. But some of us are afraid of people who look like us in our own communities. And so one of the things methods that I've used to help open our brothers' minds into the possibility of being in that space and redefining what their masculinity is I always ask 4 questions. Question number 1, what is your definition of masculinity? And usually most of the definitions are pretty similar. Being able to move how you want, do what you want, having autonomy over yourself, over your life, over your community, so on and so forth. Second question I ask is, where does your definition of masculinity come from? It's usually always pretty similar there too, right? A father, a grandfather, uncle, older brother, coach, brothers in the community that they see. The third question is where it starts to get very interesting. Does the person or space that you got your definition of masculinity live up to that definition itself? Now you see brothers really start to think. Like they're not as quick to answer, because it's at that moment that they realize what I realized a lot of times a while back about just human beings in general. The limitations we have for ourselves, we like to place them upon other people. And then when we're talking about masculinity and our place in masculinity and how that's changed over time, over the decades between, my father's generation, grandfather's generation, so on and so forth, you start to see, a lot of the brothers start to see like, nah, there's a lot of do what I say, not as I do type of stuff going on. Then the fourth question I ask is, if you've already told me that your definition of masculinity is being able to move how you want, having autonomy, being a protector, being able to say what you want, being wise, taking control over the situation, or whether that be your life or your circumstances, so on and so forth. Why have you just now told me that you've been living your entire life by somebody else's definition of what that should look like for you? And it's at that moment that he feel like there's like an epiphany amongst all, a lot of the brothers that I work with. And the reason I say that is because it's important, because at that moment, once you break down that barrier and break down for some that barrier of what they're allowed to do versus not allowed to do based on what society says what's masculine and what isn't, they start to ask themselves, well, yeah, why can't I be more present in the birthing space? Why can't I go to Lamaze classes? Why can't I learn more about breastfeeding? Why can't I learn more about birthing plans? Why can't I be more forthright in asking questions in the doctor's office? And so though when it comes to the challenges, those are the different challenges I faced. And like I said, it's very different depending on who I'm dealing with. And it still goes on today. There's a lot of work that gets done. But what I found though is once you break those barriers down with our brothers, and the more confident they are about learning information about the birth process, they're just as eager as their partners about, getting in, learning different things, showing that they know information, can retain the information, and want to be supportive, and putting together these birth plans and making decisions about which a healthcare provider to use or not use, which I think is all very important.
I mean, you said so much there that, I mean, one of the things that really all of it is valuable. One of the things I really like that you mentioned that I think sort of crystallizes that for me is that it's family work. It's, we have sometimes allowed what our responsibility is or what roles we should play to be defined by these cultural norms, and I think breaking it down to the basic elements of being family work, I think really is important. So I appreciate you sharing that and some additional examples and context there with the different groups you had to navigate some of those challenges with. William Rowe, I want to give you an opportunity to respond if you wanted to jump in on this before we move to the next question.
Support. That is why we're here. That's why we're in this space. We talk about the main question was kind of like, how are we having some of these barriers of entering this space, right? I'll never forget that in one of my previous roles, prior to joining the Black Women's Health Imperative, another colleague of mine actually wrote in an email and said, "You're in uncharted territory here." Mm-hmm. That I said, well, my immediate response was respond and say, "What do you mean?" And then I listened to myself and I said, wait, you're right. I am in uncharted territory. But because of who I am, because of what this territory needs, which is we need to promote, support, and protect birthing equity, right, for Black women. I'm here to do the support. I'm here to do that promotion. I'm here to do that protection. And so I think it's as simple as that. We respond to that barrier by saying, I'm here to support. I don't go into these spaces saying this is what I'm here to do. I go in and ask the questions. What do you need from me? How can I support you? And I think that's what we have to, that's the best way to kind of approach this from a male's point of view.
I appreciate that. I mean, it is the uncharted territory. And although we want to be helpful, it is our responsibility. This is an issue. Maternal health and the health of our families is an issue for everyone. I think there is that risk of coming into a space that too hot, paternalistically, and not approaching with that level of humility and caution and supportive mindset. So I think owning our responsibility, but doing it in a respectful way that allows us to live and learn. So we're uplifting the voices of our partners, I think, is a really important thing to draw out there, William Rowe. So thank you for that. I know all of you one of the beauties of this panel is that each one of you brings a different perspective to this work. Each one of you has a different experience, both personally and professionally, to this work. And with the charge for our time together, one is to be able to create safe spaces like this and normalize conversations for Black men to talk about ways in which we can be supportive of our partners and our family members and our community members, hopefully creating the opportunity for other Black men to follow suit and to also encourage and support those Black men who are already doing this, that there are others out here doing this work. So part of our time together is to create that space, encourage others, and let folks know it's okay to be vulnerable and talk about some of these things together as we're supporting our partners. But I think the other part of our time together is to provide some insight and recommendations for what we think, based on experiences, could hopefully make the situation better. So, given your respective lenses, the question I'll toss out to you is what sort of policy changes in your respective areas do you think could be beneficial to allow men to be more inclusive and supportive of their families in the various ways that we've talked about?
That's a great question. I know there are experts in this space, both the Williams, that will share. I'll focus more on the tech side. When Roe versus Wade was dismantled, it's still going to be a lingering effect in our community, because at one access point is then a challenge now. It's created an additional challenge because now clinics, hospitals, executive physicians are hesitant to providing care because the rules have changed in terms of supporting birthing people, getting whether that is getting preconceptions, right, or the decisions, having the autonomy to make for the birthing person to make that decision about whether or not to bring a life to this world. So Roe versus Wade is created a challenge. The dismantle of it has created a challenge, one from an access point, and hospitals then closing. That creates more additional challenge too, because first of all, zip code, we like to call it here a fancy word of social determinants of health, which is part of saying that in my zip code, where is the closest hospital to deliver a baby? Where's the closest birthing center to deliver a child? And who are the clinicians that are around me that are relatively close to get to? Whether that is a walking distance, or in the case, if it's a transportation, I may have an issue because I may not have a car. So policies that are changing, the dismantle of Roe versus Wade, and also I clearly going to be continuing to affect our community. Another issue as well, as it relates to in this tech space, we notice medical racism happening, bias in terms of the ensuring that I won't get myself into the trouble in this case here, but some insurance companies making the choice to refuse to give care to a certain economic group, right, because of previous conditions that they're experiencing. And so that itself, being intentional in the taxpayer, having the code to say, hey, these groups, they're likely to have several comorbidity, let's prevent them from getting the care that they need. That's intentional. And that's keeping someone that need medication, that need care, away from necessary care. And you've now embed that into your tech, into your code, which creates trouble. And when we talk about this AI, use of machine learning, you're literally teaching the language of that technology to recognize that this person's race, keep them away from getting additional care, because they're gonna be an overutilizer of the resources. I.e., that's what insurance companies they don't want to pay for those overutilization of resources, because their goal again is to make sure that they can keep enough profits in their pocket. I think those policies, and us in this space, whether that is tech or access points, it is our job to create solutions to ensure that those solutions aren't gonna replicate the biases that other communities already embed in our community, right? So whether that is our solutions itself have that cultural lens, inclusivity is very important. So that's my point of view in terms of how do we ensure that policies in this space are created by us? Because if we're going to wait for things to change nationally, it can be really a long, lingering process and a lot of discussion for policy to change. But for us, we have to own it and create those solutions for our community that have that cultural humility and technology that have that remove that implicit bias. to ensure that our communities have the best resources, not just hand-me-down solutions.
I think that's an important point about well, all of that from the tech space, but even your final point about making sure that there's representation at the table to sort of evaluate and look at some of those policies, the code, the formula, the actuaries, the items that are being utilized to determine care or make decisions. If that's not done, or there are not people at the table who can look at those things through a racial equity lens, then you're building systems and code that are just perpetuating the same systemic challenges that we're trying to fight against. So I appreciate that perspective. One of the things I'll toss out as a small p policy change that we were talking about in this space when we were sort of preparing for this, and I think we were creating some good conversation. I would love to see a little p hospital system, maybe standard operating procedure, where families have an opportunity to spend more time and build relationships with the larger medical care team that are providing services to the family. To your point, William Moore, that it can be a challenge for families to build a credible relationship, a partnership relationship with one provider, with one physician, a person who you spent time with over the course of your prenatal journey. Hopefully that person is accepting and is a champion and is willing to partner with you in care, respect the birthing plan and all of that. But at least in my experience, because of the potentially unplanned, unless you're having like a scheduled C-section or something along those lines, because you can't necessarily control when things are going to happen, when you're actually going to go into labor, you may end up with another physician who may be familiar with your situation, who you may have had a chance to meet in the prenatal process, but it can be like learning a whole new individual. And at least from my experience, whether or not that individual will respect the birthing plan can be a bit of a gamble in some respects. And if you don't have the benefit of a doula or someone who's in that space to advocate for you, you may not always be. You may be in a position in the most vulnerable moment to hope someone respects a plan and the relationship that's been built. So I would love to see something along those lines, if that doesn't exist already, is to have that something that happens more on a regular basis. I wonder, from your experience working with families, William Moore, how often do you see that? Is that a policy that would be helpful or challenging? Just I'd love for you to respond to something like that.
I can't say that I see it entirely too often. I think that I definitely don't believe it's the culture that we have in with healthcare providers. I think that if you have a single like an individual in that space who provides stellar service like that, I'd be more prone to identify those actions and that behavior with that individual rather than the institution that they work for. And overall, like I agree. I would like to see more policies and paternity. Like, for instance, I think there should be more birth workers, midwives, doulas, advocates on staff at hospitals. There aren't a lot of healthcare facilities that have that. Some do, but a lot don't. Because it's important that, like, let's say a family has an instance where they are. I've seen instances where families are working with particular providers, and the provider doesn't listen to them, isn't very friendly, very warming, doesn't really listen to them. This family doesn't even know that they can request to see somebody different. I would like to see policies and procedures put in place where we're actually able to like grade these physicians and providers on their behavior at our prenatal visits during while delivering babies, and that has a substantial impact on bonuses, tenure, different things like that. Because the reality is, like, we can, I can go get a checkup now, and they'll give you a little survey or whatever. They'll call you and give you a little survey, and you give feedback. But what do those things really do without tangible accountability? There's accountability, then there's tangible accountability. You know, when you affect people's pockets, people tend to act different. When you just tell people you can't do that, but don't really do anything substantial or tangible to affect how they move in the space, you don't see much change. So I think, you know, making it so that it's easier to pay birth workers, because a lot of, you know, it's not easy to go through a lot of insurance companies to pay birth workers. And I'm the type of individual too, like, and I know many other birth workers who, they hate to really put some of our families in a position where, you know, to do this work, like, it costs at the end of at the end of the birth process, and nobody really feels comfortable putting some of our families in a position of, do you want to pay for the services to make sure that you are having a pleasurable and safe birthing experience, or keeping a roof over your head and food in your mouth? That's not a situation that we want to put families in. So making it more easier for insurance companies to pay birth workers, making sure that they're readily available. Policies like that, I think, would go a long way in improving the outcomes for our Black families over time.
I appreciate that, and some tangible ways to move this work forward. William Rowe, I wanted to give you a chance to respond, but I also wanted to tee you up for the next question, because I think you have a great perspective based on what you were offering. But do you want to give a quick response to this in terms of policies?
For policy, so I come specifically from the my subject matter expertise would be more so of the maternal and infant nutrition side of things, right? And so a couple of things that I've worked on and actually been able to push through. Number one, the health department that I've worked for, there was no parental leave policy. That were at that job did not advocate for themselves and ask the questions on, well, how do we get a formal parental leave policy? And so being able, and if you're in those spaces, simply asking the question, what is the parental leave policy? Does a mom have time to pump at work? Can a mom bring their child to work? Is it Jefferson County Public Health Department, located in Colorado? They are one of the first actual workplaces that offer the opportunity for moms to bring their children to work so that they are able to feed them. Again, and I come from the chest breastfeeding space of things. And so that's a big win right there. When we're talking about the outcomes, when we talk about better birthing outcomes and initiation, breastfeeding and chest breastfeeding initiation rates. So that's one thing right there. The second part, when I travel and go into an airport, I ask, again, this is from the nutrition side of things. When I travel and go into an airport, is there a mom pod? People go. Is there a space for a mom to go and feed her infant? You can advocate for things like that if you are in corporate America. You don't have no background required, no degree required, no skill set required. It's just asking a question. And so advocacy looks many different ways for us as Black men. And then to segue into, I think, what we're about to get ready to head into, the next thing is a breastfeeding friendly hospital initiative. And so we talked about a warm handoff. We talked about including the entire physician staff. So when we have initiatives like that, where we're talking about a breastfeeding friendly hospital, number one, we're going to market differently. We're going to talk to different communities in a better way. And so it all starts there, and it starts by simply asking those questions. And so those are just some, again, these are things that I've done from my small little role. You know, I don't consider myself to be a person who has a large expertise in certain things, but that's something that we can simply do right there in policy development. That's something that we can do to improve the system and structure of public health. And you never know, those are going to lead to the greater strides, where we have the PUMP Act being passed here. I'm here in California right now. We have the PUMP Act that was passed, the Momnibus Act. So simply ask questions.
I love that. And I'm going to stick with you for a second, because I feel like there's I'm going to pull some more out of you there, because you're hitting some really good points there. Because it's a really nice segue into how we can advocate as a community. And I don't know how many of our virtual audience members saw this. I'm assuming most of them have. But the CDC just released some data that the U.S. maternal mortality rate has increased by 89% over the last 5 years. So that's obviously very concerning and frustrating for many of us who've been working on this for some time. But as that rate continues to rise, what can we do to advocate for community change? And how do we step into this conversation with United Voice? I know you've mentioned a couple times, which I greatly appreciate, as you think about the language we use around birthing people and pregnant people, and how you use very, very intentionally the language around breastfeeding and chest feeding, so we can be more inclusive in the way we approach this work. But how can we advocate as a community for change, and how can we do that in an inclusive mind, from an inclusive mindset with Unified Voice? So I'll start with you, William Rowe.
Number one, we have to be able to start adopting that language that we hear, right? And so simply, we used to always say pregnant people, a mom, Black moms. Now we're moving into this space of pregnant and birthing people. We're moving into that space of birthing justice. And so I think just adopting the language that we hear and actually beginning to use that, it's going to change the community norm. So that's one piece right there. The second part, again, I mentioned this earlier, which is showing up. A lot of places, a lot of community coalitions who are supporting birthing people, they have things called like community baby showers, especially in some of our Hispanic communities, fathers in Hispanic communities, the father actually kind of leads the way in the birthing experience. So we as Black folks, we as Black men, we can kind of take on that same practice, number one, and show up, not lead the way, but support. We show up and we ask those questions. We go to the baby cafes. I love when my friends invite me to baby showers. I go to the baby showers. I attend them, whether virtual or in person. I go. And then I add my little 2 cents in and give my maternal health spill and get the room going. And then you get smiles. And then people say, wait, you do what? And I'm like, yeah, I do this work. You know, this is what I am engaged in. It's my passion. It doesn't have to be your passion. It's mine. But if you just show up, if you just put yourself and plant yourself in those spaces, number one, you're going to learn because you're there. You have to be engaged, and not just be engaged, but be present and engaged, right? You're going to end up learning, and then you're going to take on those social norms and be able to amplify it even further in different spaces. I love when I have friends over at the house on a Friday evening and we start talking about work stuff because they're looking at my desk, they're looking at my little mini library, and I have so many books about chest breastfeeding on my library, and they're like, is that a nipple right there? Is that a bottle? Why do you have that? It's a conversation starter, number one. So I planted that purposely. But number two, it's to keep the conversation going. And then folks are leaving. And as we're going throughout the week, I get messages like, wait a minute. So remember you was talking about this? Oh, well, my girl or my wife, blah, 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 they're experiencing this. And we're now, again, going back to community. So now we have people reaching out, asking those questions, and now we're involving and engaging ourselves in the work. And just right there, you're being supportive and don't even realize it, most likely.
I love those little nuggets because after everyday conversation, we just start to, again, normalize. I want to overuse that term, but normalize the conversation. And that is a form of advocacy and support. So I definitely appreciate that. Mo, I saw you come off of mute, so I know you're excited about this one.
No, this is so interesting. This is so powerful. And as William Rowe was explaining, one of the things as we engage moms is moms will say, my child isn't latching. Why isn't my child latching to my nipple during breastfeeding? I was like, Lord, I even know that question. So being able to learn and hear what does that mean, right? And you ultimately, as a man, you're gonna become a better father and a better husband, because then you understand, okay, there's a process of latching. Why isn't the child actually latching to the nipple? And if the child is not latching too heavily, the nipple becomes sore, right? Or they're biting, they're teething. So these are things that like simple things you can truly learn by listening deeply to moms after they deliver. So it's so interesting, as William was explaining and chatting. And this is the things I'm learning on the job, right? And moms are teaching me, which is such a blessing. One thing, when you build for inclusivity, it looks so with different lens, right? For us, one question when we're building for moms, we're building for moms and their significant other. so their child, and their husband. And building for that, you have to ask, is that mom that's gonna walk through and use this mobile app and be able to access it? One, do you have the right clinicians that have a certain language, right? Whether those clinicians are bilingual. Secondly, if that mom walks into the mobile app, even if they're not able to read, is there embedded in the technology voiceover where they can actually voice and they can be able to understand and then translate this, right? So building beyond just ethnic, right, black, white, but just building to ensure that that person has other disabilities. You can actually account for those disabilities. If they have reading impairment, if they are deaf, how do you ensure that you build for your product is inclusive enough to ensure that other groups are included and they can use your product and be able to actually engage with providers and engage with moms, but in an inclusive lens. So I think that conversation hopefully then have to expand beyond just the ethnic conversation, right? To also building for people in our community that oftentimes aren't talked about. So that, I think that's probably also super important. So that's when we build, at least in InovCares, we build from that lens, that inclusivity lens, from the mobile apps, how other communities, groups engage with it.
Yeah, I love that, Mo. And one of the things that, having worked in the disability space, there's a term that was coined there: nothing about us without us. So I love that what you're teasing out there about, as we start to build some of these programs, policies, and look to engage how we include those individuals with a credible as partners who have a credible experience and a voice and are valued as partners in the conversation as we start to build and move this work forward. I want to pivot for a second because we're getting a lot of great questions in the chat, and I want to make sure we have time to get to some of these questions. So I want to toss this one out to you, William Moore, as a start. And the question is, what are some guidelines for advocacy when in hospital or medical spaces, especially when there's a gap in communication or literacy?
I think the number one thing for me, it's always clear communication. I know when I'm advocating, in the space, advocating for somebody, it's always what would make you feel comfortable? What is it you need from me right now? How can I be of service? And communicating that with our healthcare professionals. I think, a couple seconds ago, William Rowe hit it right on the head. Like, communication is so powerful. And the reason why is communication is something that we use to change the way people think and the way people move, and it's taken for granted. You don't even think about it. They think about it. You could take somebody in one part of the country with an accent, put them somewhere else, and after a while, they lose that accent. Right? They start picking up terminology and stuff from other spaces. I give you a prime example. When I was consulting with a public health department and working with some home visiting nurses, I had spoken to a couple of home visiting nurses were talking about how they had a hard time getting some of the fathers in the living room and coming to talk to them, even though they were at the house in the back room. And I asked them to kind of model for me the type of discussions that they have and what are they talking about. And on numerous occasions, one of them talked about how, like, she, they talk to the mom or recognize the mom as a single mom, even though maybe they might not be in a relationship with the father. And I had to correct her. I said, so the father's there when you go to the visit? She's like, yep. I said, how's the custody situation, or how's the visitation situation? Like, does the father provide financially? Yep. Does the father come pick the child up or take care of the kid, the child on weekends, come spend time during the weekdays and stuff like that? Absolutely. I said, well, that's part of your problem right there. I said, the language that you're using is dismissing the role that the father is playing in the household. I was like, she's not a single mom. She's co-parenting. She's just not in a relationship. There's a difference, right? And so, and I've had to tell a couple brothers that before too, because there's increasing number of single fathers, so-called single fathers out there, and a lot of them will say, you know, I'm a single dad. I'm like, where's mom? Does she help out with stuff? Yeah. She help, you know, financially with the child? Yeah. She come help with homework sometime? Yeah. Does she take the child sometimes? Yeah. You co-parenting then, you're not a single dad. And so one of the biggest ways that I use to advocate is communication, making sure that the language that I use is inclusive and making sure that I'm being of service and ask whatever questions that I need to ask to get an understanding of the family dynamics of the clients that I'm working with. What are their fears? What are the questions they have? What are the things they feel most positive about? Translating that and communicating that to the healthcare providers, and making sure that those two parties have a clear line of communication.
So how, I'm going to push on that a little bit. How are you able to do that in instances, and maybe it's a similar approach, but in instances where there might be a language barrier or some other challenge that might make it difficult for the
well, I'll say one way in which I kind of have an advantage is also I work in local government, so I actually have access to translators and not like translators through the work, and actually access to translators through the birthing community, the Black birthing community here in the Twin Cities area. So when I'm working with families like that, I don't have a problem reaching out and saying, hey, I need a translator who speaks, you know, for somebody in the Oromo community, the Somali community, the Hispanic community, whoever it may be. I don't speak that language, or better yet, actually handing them to a birth worker who is a part of that community themselves, which is actually the number one option, because they understand, not only do they understand language, but they understand nuances and differences in culture that I might not get, right? Like the Black community and Black culture isn't a monolith, you know, even amongst African Americans. And so those are ways in which I try to, bypass those barriers. And like I said, I also understand too that I have sort of privilege because of that, of the access to people that I have in my community that way.
I appreciate that. Go ahead, Rowe.
We elevate this right here, a warm handoff. When we talk about the birthing experience, a warm handoff, it's not just we leave, mom receives baby and we leave the hospital. Let's connect to services. It's a warm handoff. We got to connect to every single thing to support this family once they walk out of that birthing center, once they get done with their home birth, wherever the childbirth occurs. We need to have a warm handoff and incorporate all levels of that family. And family and community looks different for each individual, right? So a warm handoff may be to mom and partner. It could be to mom and dad. It could be to mom and aunt, mom and grandma. We have to figure out, what does that community look like, and practice a warm handoff. And right then and there, we're initiating some change.
Well, I will just add here briefly, as both Williams here said, there's part the warm handoff, but also being able to recognize that you have a limitation, and then saying, which is so powerful, hey, I may not understand your language, I have that language barrier, but I'm going to connect you to the right resources that understand that. And then that's cultural humility right there. So William Moore is practicing cultural humility. The cultural humility is not just for the white doctor, right? It's also within our community, which is so powerful. I just wanted to just stop and highlight that being able to recognize our limitation and then transferring that to the right community, the right birth worker that understands that mom and their languages, and that's powerful. And I think that's what all of us need, right? To be able to ensure that we can enact change, be able to understand our limitations, and then and acting accordingly, right? So thank you for sharing that, William.
Thank you, Mo. I want to get to this question. We've got a lot of them, so I'm going to try to pick a few out here and see if we can get through them briefly. But this one I thought was really, all of these are great questions, but I really want to elevate this one especially. It says in the birth space, men can experience PTSD, What resources, group or spaces are available for fathers, partners dealing with this? And I want to also expand that to even some of the comments that were mentioned earlier on the postpartum challenges, as the family dynamic is impacted throughout the prenatal experience, the birth process, the postpartum experience. The family dynamic is impacted and is experienced. The entire family experiences those changes, and from personal experience and from engaging with other men who are willing to share, who happen to come across my path, there's a lot of focus placed on identifying some of the postpartum depression that exists with our partners, identifying some of the triggers and challenges. But from my experience, I have not seen many supports out there for men who are impacted. Maybe not at the same, we're not impacted maybe at the same biological and physiological level as women, but as our dynamics change, we're all trying to navigate this new normal. I haven't come across many resources available for us to be able to get some support, some help beyond some of these normalized conversations we're trying to create, space we're trying to create. So I want to put that out there to others. Have you heard of any resources or groups or things that are available for men who may be experiencing PTSD or depression or challenges related to the birth space or the larger birthing process experience?
I know, William, if you heard it, so this is, and we don't get the resources. Grieving is one of those things. So one of the issue for in our community, at least, and then speaking personally here, the resources to properly grieve and to understand after that child is here, I am not equipped. I didn't feel as though I'm better equipped to be a father. Whether that is I didn't went through that prenatal class with my significant other to be able to say I'll be a better supportive partner. Moms oftentimes they don't feel that they're better equipped to be good mothers, and they have that challenges. They start having those dark thoughts. For dads, in our case, when I'll say for myself personally as well, when I lost my sister and lost my aunt, all my effort was pushed towards studying InovCares as a way of grieving, right? That I can then extend this to I can create a solution that can then impact change. But I did not stop to take this time that I am grieving and I need to actually heal. And I went through a program. I went through Google for Startups, and they gave me a therapist, family therapist. And part of that was me going through therapy for 6 months. So I took the time to just stop. Why this? It shocked when my sister died. It shocked me when my aunt died. Although I've created this platform now to support others, but I didn't take the time to grieve. And when I went home to Sierra Leone, I then began to understand even how to even better emotionally support my sister's kids, because it was literally I was sitting in the veranda, living room, and they would be bawling and crying that they missed their mom. I got a chance as a person here that I've experienced loss, and some moms again they experience loss in losing their child, right? Or the dad has lost their child. And we need those communities. For me, what resource that I tap into was the fact that I went to a therapist, right? I was honest with that, with those conversations, and I got a chance to really for 6 months work on me and my emotions, and then how to be better for myself and heal. Then I can, and then I'm better. I'm better able to be just a founder or advocate in this space. And also then that I've extended my ability to listen better from and support my sister's kids as well as they go through their grieving too. There are things that I know that I have limitations towards. I can support them financially, but I cannot support them emotionally, right? So I think tapping into those resources to be vulnerable and find therapy can really go a long way for that may have PTSD or have lost a significant, I've lost a loved one during their birthing journey. Well, let me pause for others.
No, I appreciate that, Mo. I definitely think that's an area of need, and I appreciate the individual who asked that question. You went through a journey on your own where you were trying to find the resources, but I do think that from my experiences, a gap in those things that may be readily available for the changing family dynamic and what experiences you may be, what issues you may be dealing with as that occurs. Obviously, as you mentioned, if there's a loss or grief that you experience with the loss of a partner, and from speaking from personal experience, when you're gearing up for a celebratory event, and you end up experiencing loss of a child in that moment. That's the experience I've had on a couple of occasions, and didn't feel like I had, because of the different grieving process I may have had for my wife, I didn't feel like there were resources available for me. So I appreciate someone highlighting that question, because I think it's definitely a gap that is there. I do want to. We have a few minutes left here, and I know that we could probably talk on this topic for a while. We're all passionate about it. I think there may be an opportunity for us to do a part 2. But before we close, I want to give everyone maybe a 15 or 20 second sort of final thought on the topics that we've discussed. If you had leave someone with closing thoughts or words around what can be done or what's needed in this space, I'll give you those for 30 seconds or so to do so for each individual, starting with you, William Moore.
Yeah, I would just say, it's our responsibility, and that we should all act like it, because somebody's life in our community depends on it. And I'll leave it at that.
Thank you so much, Mo.
I'm a child of an African African mother and African man. So for me, what the cliche of it takes a village, it really takes a village for all of us here to do this work. Whether that we come from a policy point of view or tech, from a birth worker or a doula, it really takes a village, and we all need to just step up and create solutions that represent our community for our community.
Thank you so much, William Rowe.
This panel tonight, I saw so many people say they're excited and that this is a really good conversation and it's going to be a rich discussion. And so my only encouragement and my challenge to everyone that's watching is to continue the conversation. Please do not let it end at 8 p.m. Eastern time.
I second that emotion. And I would just say that, one, again, thank you to Black Women's Health Imperative and Quilted Health for creating this space. I've really enjoyed the conversation, the discussion. I hope it does not end at 8 p.m. Eastern. And that hopefully we've had an opportunity to share be vulnerable, share experiences, share thoughts and recommendations. Hopefully be able to encourage others who are looking for community. Black men are looking for a community and looking for support, understanding they're not alone in their advocacy, and hopefully as we're having these conversations, we're respectful of the women birthing and pregnant people that we're advocating on behalf of. I would also say that as Black men in this space, I think there is privilege that we experienced at different points in times in our journey, and one of the things that we can do is when that privilege presents itself, to use it to uplift the voices of our partners and those we care about in this way. So thank you all for being vulnerable. Thank you for the conversation, and thank you again to the Black Women's Health Imperative for allowing this conversation to take place. With that, I'll also thank our audience for being engaged. We had a really great set of questions. And hopefully there's an opportunity for us to continue the conversation and continue to put some action behind the words and the sentiments that we've been expressing to you tonight. Thank you all again, and have a great rest of your evening.